Medications, basic pharmaceuticals. Warning: even the safest medications should be prescribed in a face-to-face consultation with a doctor. All the below data on pharmaceuticals are strictly informational and must not be regarded as a recommendation or prescribed treatment. Medications for the nervous system, sedatives. Every country has its own dispensing rules. Since you are trying to solve the problem by yourself, visit a pharmacy, find a pharmacist and say, "Please, give me the strongest sedative you have." Once it is offered, say, "I'm not sure it'll be effective enough for me. Please give me another strongest sedative but with a different composition." Most probably, both the first and the second drugs will be of plant origin. Say, "Please tell me how I should take them together to achieve the maximum calming effect. Is it safe?" This question may surprise the pharmacist, who is likely to suggest that you should visit a doctor, and this is the right thing to do. But still find out what information required by you they have and can make available to you. Antidepressants. Addictions are often accompanied by depression syndrome. If the answers to questions 3, 5, 7, 8, 9, 11, and 13 in the condition assessment table produce the score of 8 and higher, you are likely to have symptoms of depression. In this case, consider taking herbal antidepressants containing St. John's wort. Attention! Do not start taking these medications until you have read the part of this book that deals with depression, anxiety, and asthenia. It means not before day 8 or 9 of withdrawal from alcohol or tobacco, and unless your score has decreased by that time. Depression symptoms may be signs of withdrawal syndrome. If so, they will be considerably reduced without antidepressants by day 8 or 9. These medications should be administered for a few, usually 3 to 4 months. Therefore, it is much better to consult a specialist first before taking anything. The antidepressant effect evolves no earlier than 2 to 3 weeks after the start of administration. The process takes time. If you feel you have a depression, ask a pharmacist for an antidepressant containing St. John's wort and administration instructions. Such medications may not be available in all countries, but you can make a try. Hypnotics. Refresh your memory. If you have problems with sleep or feel totally bad, it is better to sleep than suffer. However, over-the-counter hypnotics may prove insufficiently effective. Warning: it is particularly important to have normal sleep patterns when you abstain from the systematic and/or massive use of alcohol. The patient should sleep at least 6 hours a day. With 2 or 3 sleepless nights after the withdrawal from alcohol, there is a very high risk for developing delirium tremens. If this is relevant to you, you must read this before you completely abstain from alcohol. The tactics are the same. First, ask a pharmacist for a strong hypnotic drug, and then for another strong hypnotic drug with a different composition. Use medications as prescribed on the label. You must be aware of contraindications and side effects. It is even better if you consult a physician. Refresh your memory. Select the dosage of a sedative as described above. Every time, assess your condition 30, 60, 120, 240 minutes after the administration of the drug. The effective dose should produce sedation, a calm, slightly relaxed and sleepy state within 40 minutes to 2 hours after the administration. The effect will last for 4 to 6 hours. The goal is to achieve a slightly sleepy state. Continue with the dosage that has produced this effect. Medications must be taken strictly at the same time. Time between administrations must be at least 5 hours. On the second or third day of withdrawal, the goal is the same. Achieve a sleepy state without particular activity. If even 2 average therapeutic doses taken on the first day are not enough, you can try and take one more sedative medication using the same pattern: half, 1, and 2 average therapeutic single doses, morning, afternoon, evening. If the effect is achieved, stop increasing the dosage. Please keep in mind that the more medications you take, the less predictable the effect is. There is no sense in combining drugs of the same composition. Keep in mind that a lot of medications are available in the form of tincture. It means they contain ethyl alcohol. Therefore, it is senseless to treat alcoholism with tinctures, although alcoholics may enjoy it.